Ladies and gentlemen, today I stand before you to shed light on a pivotal event in our shared history, the Spanish flu pandemic of 1918. This devastating global health crisis claimed the lives of millions, leaving an indelible mark on societies and shaping the trajectory of modern medicine. Join me as we delve into the origins, events, and legacy of this momentous period. The Spanish flu, contrary to its name, did not originate in Spain. The exact origins of the virus remain uncertain, but it's widely believed to have emerged during the final years of World War I. As soldiers moved across borders, cramped in unsanitary conditions, they unwittingly became carriers of this virulent strain of influenza. The crowded military camps, hospitals, and trenches provided a fertile breeding ground for the virus to mutate and evolve into a formidable adversary. The first recorded wave of the Spanish flu struck in March 1918, initially showing mild symptoms similar to the seasonal flu. However, it quickly mutated into a more lethal strain, causing widespread illness and mortality. This initial wave, although significant, paled in comparison to the subsequent waves that would ravage the world. It was during the second wave, which emerged in the fall of 1918, that the Spanish flu reached its devastating peak. As the virus mutated further, it exhibited a vicious, unparalleled in modern history. The effects were catastrophic, with young adults, normally resilient to influenza, falling victim in unprecedented numbers. The impact of the virus was exacerbated by the social and economic upheaval of the war, as medical resources were stretched thin, making it even more challenging to combat the disease effectively. This death toll of the Spanish flu is difficult to ascertain with complete accuracy due to limited data on varying reporting practices at the time. However, estimates suggest that the pandemic affected approximately one-third of the global population, claiming the lives of 50 to 100 million people. To put this in perspective, the death toll of World War I, which was nearing its conclusion, was eclipsed by the magnitude of this silent killer. The legacy of the Spanish flu cannot be understated. Beyond this immediate loss of life, the pandemic had profound social, economic, and medical repercussions. The healthcare systems of the time were ill-equipped to handle such a massive influx of patients, leading to the reevaluation of public health infrastructure and medical practices. The Spanish flu served as a catalyst for advancements in virology, epidemiology, and disease surveillance, ultimately paving the way for future breakthroughs in the field of public health. Furthermore, the societal impact of the Spanish flu cannot be ignored. The pandemic brought communities to a standstill, disrupting daily life, straining healthcare systems, and instilling fear and uncertainty among the populace. It serves as a somber reminder of the vulnerability of human existence and the importance of global cooperation in the face of such crises. In conclusion, the Spanish flu pandemic in 1918 left an indelible mark on our history, forever altering the course of medicine and global health practices. It serves as a stark reminder of the devastating consequences that can arise when infectious diseases are left unchecked. As we reflect upon this period, let us remember the lives lost, honor the resilience of those who fought against the virus, and strive to ensure that the lessons learned from the Spanish flu continue to guide us in our efforts to protect and safeguard public health. Thank you. Now, here are our 10 factual details about the Spanish flu pandemic. Number 1, the Spanish flu pandemic lasted from 1918 to 1919, with some outbreaks continuing into 1920. Number 2, it is estimated that the Spanish flu infected approximately one-third of the global population at the time. Number 3, the death toll of the Spanish flu is estimated between 50 to 100 million people worldwide. Number 4, the mortality rate of the Spanish flu varied widely across different age groups, with young adults being particularly susceptible. Mortality rates for this age group were much more higher than for other flu strains. Number 5, in some areas, the mortality rate reached as high as 20% for those infected with the Spanish flu. Number 6, Spanish flu had rapid onset, with some individuals dying within hours or days of showing symptoms. Number 7, the virus responsible for the Spanish flu was an H1N1 influenza A virus, but its origins remain unclear. Number 8, unlike most strains of influenza that primarily affected the very young and elderly, the Spanish flu disproportionately affected young adults between the ages of 20 and 40. Number 9, Close quarters and unsanitary conditions in military camps and trenches during World War One facilitated the rapid spread of the virus. Number 10. The name Spanish flu is a misnomer, and Spain was one of the few countries that openly reported on the severity of the pandemic due to its neutral status during World War One. Media coverage in the other countries was heavily censored to maintain wartime morale. These factual details provide a glimpse into the magnitude and impact of the Spanish flu pandemic, highlighting the global reach, high mortality rates, and unique characteristics. Now, here are some essay prompts that you can use to guide discussion about this topic. Number 1, analyze the global impact of the Spanish flu pandemic in 1918. How did the virus spread across continents, and what were the social, political, and economic consequences of the different regions of the world? Number 2, discuss the role of medical advancements and public health measurements in combating the Spanish flu pandemic. What were some key medical interventions and strategies employed during the time, and how do they contribute to the management of the outbreak? Number 3, examine the social and cultural effect of the Spanish flu on communities. How did the pandemic disrupt daily life, influence public behavior, and shape societal norms and attitudes in the aftermath of the crisis? Number 4, compare and contrast the Spanish flu pandemic with other major historical pandemics, such as the Black Death or the COVID-19 pandemic. What were the similarities and differences in terms of the impact, societal response, and medical understanding? Number 5, explore the legacy of the Spanish flu pandemic in the field of the public health. How did the experience and lessons learned from the Spanish flu shape future pandemic preparedness, disease surveillance, and global health policies? All right. Well, thank you for listening. Have a great day.